my name is Cindy Reyes and my demonstration speech will be over first aid for cuts and scrapes. I will start off by asking you all, what are the 3 P's of first aid? The 3 main objectives. In case you don't know already, the 3 main objectives of first aid are to preserve life, prevent worsening, and promote recovery. So if you guys don't know this, it is important for you guys to know in order to remember when doing first aid. So this will be a great time for you guys to learn something, some basics about it. So the purpose is for you to learn today, have acknowledgement, just be aware and know the steps of how to apply first aid, and to just look out for signs of an infected wound. So we're going to define first aid. We've been talking about first aid, but now we're going to define it. So first aid is an immediate care or treatment that is given to an injured or ill person before professional medical aid that can be obtained. In this case, we're going to talk, it would include of cuts, scrapes, or scratches. My own experience, I'm pretty sure everyone has had a cut or a scrape sometime in their life. Just making sure you treat it properly, and don't leave it ignored. I also want to share that I did have first aid certification because of the program I was in my high school, which is known as a POTW Biomedical Sciences. I've gained the certification, and ever since I've been more aware of the importance of it, of why to do it, and just making sure to teach others, like I'm gonna teach you guys all right now, about how to do first aid for cuts and scrapes. It can be something basic, but it can lead into something as big as a complication. So preview, we're gonna talk about the steps. I'm gonna tell you a little bit of the signs of an infected wound, and then we're gonna reiterate the information we talked about. So first aid for cuts and scrapes steps. So this one, I'm gonna cover the guidelines while demonstrating you all how to do first aid for cuts and scrapes. So there are 3 steps. There's the prepping, the cleaning, and the dressing. For the prepping, you need to gather your materials first, and then wash your hands thoroughly with soap and water for 15 to 20 seconds. You also need to apply pressure if necessary. I say this, I'm gonna explain this when I'm demonstrating for you guys. The second step is the cleaning, which is you're gonna wash the cut and dry the wound. You're gonna apply antiseptic in an antibiotic ointment. And for the third step, which is the dressing, this will include covering your wound with a band-aid or gauze. And I'm also gonna suggest you all to change it twice daily. So for the prepping, I've gathered my materials here. So I don't have a sink, so I'm gonna use this container. I have a cup of water, my antiseptic, my ointment cream, my gauze, and my band-aid, and cloth or paper towels you can use. You can also use gloves if you have any available. So the importance of washing your hands is for you not to treat your wound with dirty hands, because if you have any dirt, bacteria, it could go inside your wound, and then it will give you a high risk of infection. So this is my wound right here. Sorry. I'm going to apply pressure to demonstrate you guys, and this is done whenever your bleeding doesn't stop. So you're going to apply pressure to the wound, and this will allow the blood to clot. If your bleeding doesn't stop, you need to do another step, which is raising your arm or whatever part of your body is wounded above your heart, and this will allow gravity to keep your blood from rushing out the wound site. Once the bleeding stops, you need to clean your wound. So that's the second step. You're going to clean your wound with running water. And then when you're cleaning your wound, you might feel a normal feeling of stinging or like pain. And it's normal, don't freak out, okay? And then you're gonna dry your wound. Once you dry your wound, the next thing is to apply an antiseptic ointment cream. If you do use an ointment cream, you can use 1 layer. 1 layer should be enough. And then I'm gonna apply the antiseptic alcohol. And the goal for this is to prevent the growth of bacteria surrounding your wound or inside your wound. And once you do that, you dry it around so it won't be soaking wet. The third step will be the dressing. In this part of the step, you're going to use a Band-Aid or a gauze to cover the wound. And the goal for this one is to prevent the wound from having elements inside or once it's healing. So if you do use a gauze, make sure you wrap it around with tape and make sure it's not too tight or too loose. Not too tight so it can allow blood circulation, not too loose so nothing can go inside of it. In my case, I'm gonna use a Band-Aid, so I'm gonna apply the Band-Aid, to my wound, and this is it. One suggestion I give to you is that you change it twice daily because it does get dirty and we don't want any bacteria to go inside the wound. So if your wound does become infected, some signs will be if you have pain, fever, redness or swelling or discharge of pus. It can be yellow or a green color. So make sure if you do have any signs of infection, you seek medical help. In conclusion, to conclude, now that we completed the coverage of what first aid is, the steps, the signs, you can feel more comfortable in performing first aid for cuts and scrapes for yourself or for others in case of any emergency. So to conclude, from cuts to scrapes to punctures, everyone has accidents regardless of your age, and understanding the procedures will help not just prepare you, but just mean the difference between life or death for anyone, for yourself, for family members, friends, etc. And that's it.